Hello, my name is Isadora Nani. I am an undergraduate medical student, and today I'm gonna present my work entitled Oregano Essential Oil Presented Antiproliferative Action in PANC-1 Cell Lineage of Pancreatic Carcinoma by Increasing Reactive Oxygen Species. So first of all, we have the pancreatic ductal adenocarcinoma, that is the most common neoplasia of exocrine pancreas, representing 90% of the cases. However, they are very rare, representing only 3% of all neoplasias. In spite of their rarity, their malignancy and asymptomatic progression leads to only surgical treatment, showing high deadly rate. In addition, this aggressive biological behavior includes a resistance to chemotherapy treatment, leading to the need of new possible drugs. One of these possible drugs is the oregano essential oil that is obtained from Oregano vulgare plant and showed great potential for alternative treatment. Besides the anti-tumoral activities, the oil also presents antibacterial, antifungal, antiparasitic activities, having the two main compounds, carvacrol and thymol, responsible for that. Also, this tumor is so deadly that in a 5-year survival rate shows 10% or less of survival rate, according to the American Cancer Society. For our objectives and our treatment, different concentrations of OEO was used in PANC-1 cell lineage, a pancreatic adenocarcinoma cell. The aim of this work is to present cellular mechanisms related to adaptations that was followed up by apoptosis after the treatment, such as increase of ROS, mitochondrial membrane polarization, identification of lipid droplets, and autophagic vacuoles. All of this showing significant signs of cellular destruction after the treatment, with p-value under than 0.005. For our methodology and cell viability, we use the MTT assay. The MTT reduction is usually analyzed by a colorimetric assay to study mitochondrial dehydrogenase activity as a test of cytotoxicity. We use that for evaluation of cytotoxicity of the OAO with different concentrations, between 25 and 200 micrograms per milliliter. For the mechanisms of action of the OAO, we measure ROS, mitochondrial membrane potential, lipid droplets, and autophagic vacuoles by MDC staining. For our results and the first graphic, we have the results of MTT assay showing significant statistic results in all concentrations, showing even better results in concentrations higher than 50 micrograms of OAO. For the control of this experiment, we used a treatment cell with fetal bovine serum, the vehicle with only DMSO, and hydrogen peroxide for negative control. This assay was used to perform logarithmic regression that show IC50 value of 50 micrograms per milliliter that we use for the following experiment. For the mechanisms of ROS. So the anti-cancer cytotoxic drugs can damage the DNA by producing free radicals, such as ROS species. And the increase of ROS was measured for identification of apoptosis signs, being the increase of ROS above the basal level related to cellular damage. The oxidation of H2-DCF to DCF, it is not specific for hydrogen peroxide, but is greatly reduced sensitivity as compared with other ROS species. And for our TMRA, it is the decline in mitochondrial membrane potential, the MMP. So we have the structural changes in the mitochondria that may be required to achieve complete and rapid cytochrome C release. And a decrease in mitochondrial membrane potential leads to a matrix condensation and exposure of the cytochrome C, following cell death by apoptotic insult. So for our lipid droplets, the NIORAD inhibits properties of a near-ideal lysochrome used to identify the rapid accumulation of cytoplasmic lipid droplets, a characteristic of apoptosis. The inhibition of fatty acid oxidation can be explained by a rapid rise in a mitochondrial membrane potential and attendant increase in the levels of ROS. For the last graphic, we use NDC staining for identification of autophagic vacuoles, the last stage of apoptosis. They also show great results under treatment with significant statistics. For our conclusion, the OAO show great antiproliferative activity in the PANC-1 cell lineage by increasing ROS levels, leading to a cell adaptation mechanisms, thus presenting to be alternative for future treatments. Despite of that, further studies will be carried out in the elucidation of the OAO activity in the oxidant status, cell cycle, and involvement in programmed cell death. These are my references, and this is my acknowledgements and special thanks to Lading team and collabs and my colleagues from undergraduate school.